For this week's health topic, we took a trip to the Student Health Center to talk to Nurse Practitioner Jeanette Richards about how to survive cold and flu season. First, we wanted to know, what's even the difference between colds and flus? How do you tell which one you have?
I think the biggest major difference is usually people with colds have a little bit of a runny nose, a cough, might not be feeling their best, but they're still able to get out of bed, go to class, take some medicines for decongestants or antihistamines, cough medicines, and they usually don't have a fever. But when students have the flu, that's a little bit different. They tend to be much sicker. They tend to have fevers. Several students have fevers over 102. Tend to be sicker longer. The cold may just last a few days. The flu could last up to a week. Students with the flu have a lot of body aches, fatigue, need rest, hydration, and need a little bit of closer monitoring too. And also the flu is highly contagious. Colds are as well, but the flu is more concerning because the flu can turn to something more, it can sometimes turn to something more infectious that can make the student sicker too.
Well, maybe investing in some medicine that promises to prevent or even shorten a cold will help you out. But do those miracle immune strengthening drugs really work? Nurse Richards says, it all depends.
The difficulty with a lot of over-the-counter and herbal remedies is that there aren't necessarily proven studies that can document their effectiveness. I tend to feel that if a student feels vitamin C helps them with their immune system, then take the vitamin C. It's certainly not going to hurt. A multivitamin, there's other things like Arbonne and other types of over-the-counter remedies that people feel really help. Is there any documented proof of their assistance in making it quicker duration of a cold? I'm not privy to that. I don't think there's really been any studies, but if they help, I say go for it. For the flu, there's actually prescription medicine that can help with the flu. There's a drug called Tamiflu that we can prescribe that can help shorten the duration of the flu. It doesn't take it away altogether, but can make you feel better quicker.
And how about the dreaded flu shot? Have you ever felt sick after getting one?
That is a very, very common myth. The flu shot cannot give you the flu. That is scientifically proven, and I would recommend anyone concerned with that to visit an accurate website for information, such as cdc.gov has very good information about the flu shot and if it can give you the flu. But the flu shot is actually inactivated flu virus. It is not active flu virus. So by getting the shot itself, you're not actually giving yourself the flu. It's an inactivated virus. It just helps prevent it. The flu shot's made differently every year, so it's a different strand. This year's flu shot isn't very effective, they've found, against this year's strain of the flu. But still, even if it's some of its effectiveness, just might make you not get as symptomatic. But you can't get the flu from the flu shot. Studies have found that people that are injected with saline have just as much symptoms of fever, pain at the site, muscle aches, body aches after having the shot with the saline as they do with the flu. So sometimes you can have a reaction just from getting a shot, period. Your body reacts to anything being injected, but you can't get the flu from the flu shot.
It seems that this one shot can play a big part in keeping you healthy during the winter. So we asked people, did you get the flu shot this season?
I did not.
No.
No.
I didn't, no.
No, I did not.
No, I haven't.
I did not.
I did not get a flu shot this year.
Every person answered no, and the most common reasons were fear of needles, lack of time, and not seeing a need for it. Nurse Richards encourages all students suffering from cold and flu ailments to visit the health center for medicine, advice, and yes, even the flu shot.